Hey, everybody. Welcome to the live stream. We are really excited. We are going to be meeting up with some of the team from Mary Freebet in Kalamazoo. We are talking physical and occupational therapy. We've got two great experts from our team in their outpatient location in Kalamazoo. On the live stream, we've got Ryan Langejans. He's a physical therapist, and we've got Dave Renter. He's an occupational therapist. So thank you both for joining us in this conversation, and we'll just dive right in. Ryan.
Great.
How would you define, for someone who's never fully understood physical therapy, how would you define it?
Well, the way I see it is basically you have three different things that we use. We use exercise, we use posture, we use positions in order to help people improve their quality of life, whether it's getting rid of pain or improving some kind of functional limitation that they have.
And then Dave, for you, working in occupational therapy, you're not just helping people find a job. How would you define the difference of occupational therapy from physical therapy?
I always like to remind people, that I like to ask them, what's meaningful to you? And I like usually kind of just talking about what is an occupation and tell people that an occupation could be really anything that's meaningful to you. It can be more than just brushing your teeth. It could be gardening. It could be picking up your grandchildren and getting on the floor and playing with them. It could be anything. And I like to just stress that the occupation piece it's that meaningful activity or activities that someone used to be able to do, and because of some injury or pain, they're currently not able to do. And so I kind of see that as one of the big differences is we're really kind of trying to tap into those occupations that are meaningful to somebody, to that person, and help them kind of be more independent, pain-free, and so they can resume their normal lives like they did before their injury or illness.
Yeah, that's great. That's great. I mean, that's just rehabilitation, getting people back to the life that they want to have. So Ryan, there's lots of different diagnoses and injuries and illnesses that you guys treat. But speaking about this location in Kalamazoo, what are some of the most common injuries and illnesses that you and your whole team there cover and help people with?
Well, specifically as far as what I tend to see, I'm a spine specialist, so I see a lot of low back pain patients, a lot of neck pain patients, headache patients. Oftentimes when they have pain in an arm or a leg, it's radiating from the back, and sometimes that can be very deceiving for patients thinking this must be a knee problem, when it might not be a knee problem. It might be a back problem that's exhibiting itself with knee pain. So I see a lot of those types of patients, but in the clinic as a whole, we'll see a lot of patients that have Parkinson's, or patients that after a stroke, or patients that have poor balance. Just a whole host of different things that we'll see people for. So it kind of runs the gamut. There's persistent pain patients would also be included in that. Mm-hmm. So there's a whole host of things that we do treat here.
And Dave, what about you? Anything specifically within occupational therapy that they might only come to you versus mm-hmm. Collaborating, working with Ryan as well too?
Yeah, for me, I've been was certified last year in lymphedema therapy. So that's the CLT after my name, certified lymphedema therapist. So typically, the things that are a part of lymphedema therapy include manual lymph drainage and compression bandaging and things like that. Mm-hmm. And getting people set up for garments and maybe a pneumatic pump at home. And so those are things that people come directly to me for because of that specialization, which is very unique. So lymphedema is definitely one area that I specialize in. And to follow up with what Ryan was saying, we also do a lot with neurological conditions. Mm-hmm. One of probably the most common that we see here is patients, stroke survivors, and that's something mm-hmm. we really collaborate on between PT and OT, and also speech therapy. Some other areas too, we help with patients with dementia and providing caregiver education, just on how to kind of manage those symptoms so that their loved ones can stay as independent as long as possible. So kind of empowering the patient and also the family in dementia care is another area as well that people may come specifically to see me for, or also speech therapy in that regard for those needs.
Now, Ryan, you've been here at the location in Kalamazoo, I think since it started. Dave, I don't know if it's the same for you as well too, but tell me a little bit about what's it like being in Kalamazoo, in like where about in town are you guys located at?
Yeah, I've got about this. What is it like to be in Kalamazoo? I've been here pretty much my whole life. It's a wonderful place to be. I enjoy living here, and it's a nice place to have a family grow up. Specifically, where Freebed is on Stadium Drive, just west of 9th Street, about a mile west of 9th Street. It's a nice location. We have some beautiful woods behind us, so it's very therapeutic setting. So I think it's a nice place to come for rehab, and it's a nice place to live as a member of the community.
Awesome. And then Ryan, how did you get started in physical therapy? What kind of like special training did you get?
Well, I got started based on a number of injuries I had as a young adult playing sports in high school and so forth. I was always fascinated about, okay, what's causing this injury and what makes it heal? What's the process of that? So it got me interested in the medical field. And then in undergrad, then I decided to go into physical therapy. And I had a number of injuries when I was young adult, spine related, the typical back pain and neck pain, and that recovering from that was very helpful. And as far as like developing a passion for helping others be able to come out of back pain and neck pain. So that's where my passion lies. I think it's really been a nice fit. Sometimes I would just wonder, why do I have this back pain? Why do I have to have this? And I think the answer was so that you can help others. And so I think that passion is, I'd like to think for a lot of my patients that they can see that I am passionate about helping them recover as, the same way that I've recovered. So that's part of the reason why I got the certification in mechanical diagnosis and therapy, MDT, which is a specialized spine program. It does incorporate extremities too, but it's primarily for the spine. So I think kind of everything kind of came together over the last 20, 30 years to allow me to be here where I am today.
I love it when a story comes together, comes full circle. Dave, what about you? Did you have any like specific passion or thing that brought you into occupational therapy?
I've always enjoyed working with people. My background is unique in that my first career was in music.
Okay.
Taught music. I played music. Saxophone is my main instrument. And I just loved, kind of that collaboration, that collaborative feel when I would play music. But way back in high school, even I thought, at some point in my life, a career in healthcare would be wonderful. I originally actually am from Canada, and when I moved here with my wife to Michigan, I just felt like the right time for a change of careers. It's something where I was looking for something where I could be even more, where I could impact individuals in a even more meaningful way. Certainly music has a way of doing that as well, but I wanted kind of something more specific in the healthcare field. And I wanted to, in investigating different types of healthcare fields, I thought, what's a profession that allows me to still be creative, kind of like I would be in music with notes, in therapy, is there some way I can still be creative, be able to think on my feet and help somebody and kind of like improvise. Kind of my background was in jazz where I was improvising. And similar to music and therapy, we have a structure we follow, and we want to keep people safe and work within sort of those confines of their capabilities. And so that's kind of what led me into occupational therapy, was to kind of make a greater impact and still kind of do that, kind of work with individuals or families, just like I had done in my previous career. So OT was sort of my calling, and I loved it. So, and love it now, of course, as well. So
yeah. Well, awesome. And you speak about like the jazz and the collaborative within playing music, but you guys as therapists will also collaborate too. You'll have patients that will come and work with both of you. How is that, special and unique that we have here at Mary Freebed, this interdisciplinary where that you guys are collaborating with other people within the office, whether it's physician, speech therapy, physical therapy, occupational therapy? What's that like?
Yeah, it's, I think, very fluid. It's something we I think recognize from an interdisciplinary standpoint how well we work together. And first and foremost, our focus is on that person that comes in and needs our care.
Mhm.
And if we recognize that maybe there's something beyond our scope of practice, let's say maybe like with Ryan, with if somebody comes in with an injury or pain related to their spine, and maybe that comes up when I meet with them, it's something I can kind of collaborate with the patient, and reach out to Ryan, maybe even the doctor, just to get that other referral. And then we kind of, collaborate that way and touch base to see what we can do to kind of meet, the needs of that person together. So I feel like pretty much daily there's an ongoing sort of dialogue between all of us, just in terms of, are we meeting the patient's needs, and, what else can we do to help them be more pain-free and independent. So,
talking about the patients there, I mean, that's really what drives you guys to work every day, as to how to help the patients. Ryan, do you have any like recent success stories that stand out to you you'd want to share?
Yeah, I was earlier this week. This is kind of a nice way to come back from vacation. And on Monday morning, I'm working with a patient. I've worked with her for a number of weeks already. And one of her big goals was, I want to be able to run again. She had back pain and she wasn't able to run. And what I call her exercises that help her pain or help her move better, I call those healing exercises. And that, I think patients can really resonate with that. This is an exercise that I do that helps me heal. And so she has a number of healing exercises. And so she was doing them. And then we tested her running on Monday morning, and she was able to run. And
Awesome.
She got emotional, and she says, I haven't been able to do this in 2 years. And she says, I'm going to spend the rest of the day crying, is what she told me.
Ah.
And she was crying tears of joy. And so it was a really nice way for me to start, selfishly speaking, is to start my Monday after a vacation with that kind of response to my first patient coming back. And so that's really, it doesn't get old. I've been doing this since 94, and having those kind of responses to patients, it really makes my day. Yes, some things are the same. Your documentation is the same. You go through the same, but that person that has had that life-altering change, something they haven't been able to do in 2 years, that's pretty exciting to share with them.
Dave, what about you? Any recent stories that really kind of tug at your heart and, fill your bucket?
Yeah, I think I had one patient recently who was able to pour themselves a cup of water from our water fountain that we have. And when they first came in, this individual had a very severe stroke impacting their right arm. They were really unable to lift it, really to grab anything. And, again, I always like to talk about the miracle of occupation and repetition. We were able to, have him walk over to the cooler here, and he was able to reach and grab the cup. And, he poured himself a cup of water and then shed some tears. I think I may have done that too. It was, it's amazing when you see that kind of progress, like Ryan was saying with his example as well. Just to see that meaning and that impact. I think sometimes as clinicians just take it for granted. We come here, we're able, we can move, we're generally not in pain. And, you forget, like, wow, just something like reaching for a cup and trying to get a glass of water. It's such a challenge for some of the people that we see. And, to be able to make that progress and improvement like that is really profound. So, I've got several of those kind of stories that really stick out, and where families have thanked me for the work that I've done and shown them. And,
That's great. Oh, man. And two different skills or things that they're doing, but probably have just the same amount of impact on that person when they reach that milestone. Guys, are there any new services or like diagnoses that you're working with now at the Kalamazoo location that's new, that you're just starting to kind of get off the ground?
Well, I kind of mentioned before, with my certification as a lymphedema clinician, that's certainly something, it's a kind of a new passion of mine. It's something I've always wanted to do. And being here with Mary Free Bed, I've been given that opportunity to be certified in that very kind of special area. And I think a very important area of need in the community. I also do wheelchair evaluations. We typically, I usually will see 1 or 2 individuals every week. We partner with local DME or durable medical equipment providers like CareLink and Airway Oxygen that come in, and we help assess individuals in need of new wheelchairs. And then also I help with just return to work, what we call functional capacity assessments. And those are really important too, for people kind of looking to either return to work or kind of, just to help out so that they can work more comfortably and pain-free. I also provide that service as well.
So Ryan, go ahead.
I was going to say, as far as something that's new in my world here as a PT, I think there's been some new treatment approaches within the scope of knowing what works for spines and knowing what works for low backs and necks. I'm thinking specifically about some new knee therapies that I've kind of explored based on some of the knee challenges I've had, and then I've learned some things that have worked for me. Now I apply it to the knee patients that I have and the back patients that I have, and noticing that there's a lot of other healing exercises that we can use for patients that I didn't realize were healing exercises until just recently. So those kind of things happen on a regular basis. I think they happen more often as we continue to strive for excellence. And I think I was talking to someone recently about like a business. Businesses tend to either grow or tend to decline. They tend not to stay stagnant. And so for our practice as an OT or PT or as a Mary Free Bed clinic in Kalamazoo, we can either grow or we can stagnate and go downhill. But it's really hard to stay kind of level. We don't want to stay level. We want to continue to look for ways to improve our services, look for ways to help people. So that's the kind of new things that I've seen lately is some new approaches for knee and back patients.
Awesome. Well, that's so great. Well, Dave and Ryan, I really appreciate talking with you guys. We're going to start wrapping up this interview here. And I just keep hearing that healing exercises, and that really hit me this time. It's just sometimes people might have the myth that, oh yeah, PT is just, exercise and I can do that on my own. But like you guys are giving the advice and working with them on this healing exercises. If someone is maybe nervous about starting therapy, whether physical therapy or occupational therapy, what would be something either of you guys would say to them to just help them kind of get over that fear or nervousness about starting to work with you guys?
I think I would just remind them that what's unique about therapy and what we do in our outpatient setting here is we really customize our program. It's unique to each person. It's not kind of a cookie cutter. Here's some exercises and you're out the door. We want to find that just right challenge for those individuals when they come in. Is it strengthening that they need to work on? Is it a balance issue? Is it pain? Is it really just sort of chronic pain that they have? And, what are some things we can do or instruction that we can provide? And I like to stress to at least the patients that I get to see in occupational therapy is that therapy isn't always exercise. It could be something functional. It could be different activities, or it could be even just a way of thinking, a different way of thinking, or just positioning to improve pain or their independence. So I think for me, that's always the big thing I like to stress in the beginning is that therapy isn't just going to be exercises all day, and it's other things as well that go into it. And that's something I always like to try and just remind people of that, we got to think outside the box, kind of holistically, and, what can we do to really help you in the grand scheme?
Yeah. And Ryan, as we wrap up, if somebody wants to work with your team, we've got some pictures of your team here in the office down there at Kalamazoo doing some of our Spirit Weeks, dressing up and being out at some of the events. So, but if someone wants to work with your team, whether it's physical therapy, occupational therapy, how can they get connected and start having appointments with your team?
I think the easiest way is just to let your doctor know that you want to try therapy for whatever ails you, whatever your goal is. And oftentimes then they could just send a referral over to our clinic. Sometimes I have patients that just call our clinic and say, hey, I want to start therapy. And then we can kind of start the process of getting them set up for therapy. Either way, I think would be great. Sometimes
Mm-hmm.
I'll have potential patients just call me on the phone and say, could you work with this? And then I'll spend the time to talk to them on the phone and then kind
Mm-hmm.
of answer some of their questions and say, okay, talk to your doctor, or, and let's get this thing rolling and we'll go from there.
Excellent. Well, Ryan, Dave, thank you so much for chatting with us. We've been highlighting our Kalamazoo location there on Stadium Drive in Kalamazoo. Outpatient, talking about physical therapy and occupational therapy. We'll be back on the feed in a couple months, learning some more services that they offer at that location there. Thank you so much for watching, and stay well.